Every year, World TB Day is celebrated for spreading the awareness among the people about TB and reviewing the progress and looking towards the TB free India. Namaste, I am Dr. Shailendra Kare for the channel TB Mukti Suraksha. Friends, on March 24, 2025, the world comes together to celebrate the World TB Day and mark the progress and achievement made in the fight against the tuberculosis. The theme of the World TB Day 25, which aligns with the National Tuberculosis Elimination Program (NTEP) in India, is S. We can end TB. Commit, invest, and deliver. This theme motivates us to continue its efforts toward eradicating this deadly disease. India has a long standing battle against the tuberculosis, with it being one of the leading causes of the death in the country for decades. However, there has been a significant decline in the TB cases and deaths in the recent years, and the country is now at the critical point in its journey towards eliminating this disease. According to the recent data from the World Health Organization, India accounts for having a significant improvement in compared with the previous years. Over the past few years, the Indian government has taken several steps to combat the TB and improve the country's overall healthcare system and the National Strategic Plan for the Tuberculosis Elimination. National Strategic Plan for the Tuberculosis Elimination 2017-2050 was launched with the goal of eliminating TB by 2025. This plan focuses on the early detection, effective treatment, and strengthening the healthcare system. One of the crucial steps in a plan is making a TB treatment should be easily accessible to everyone. The government has implemented various such a diagnostic test and free treatment for all the patients through the Nikshay Poshan Yojana. This has not only helped in early detection of the TB but also ensured that the patient receives the proper treatment without any financial burden. Another significant improvement in India's fight against the TB is the introduction of the new, more effective drugs and treatment regimen. The government has launched Bidaquiline, a new drug that has shown a promising result in treating the drug-resistant TB cases. Along with this, the country has also started using a shorter regimen which have shown the better compliance rate and outcome. However, the government has also taken the steps to increase the awareness and reduces the stigma surrounding the TB. With the launch of the campaigns such as TB Harega Desh Jitega, there has been a significant shift in a public's perception, and the TB people are now more aware of the disease and its symptoms, leading to more people coming forward for testing or treatment. While we celebrate the progress made, it is essential to recognize there are still many challenges in the fight against the TB. One of the biggest hurdles in the TB burden is a high TB burden of the drug resistance cases. Resistance TB in the country. India has an highest number of the drug resistance TB cases in compare with the global, making up about a quarter of all cases. It is a more severe form of the TB that is resistant to the first line of drug used for the treatment and making it harder to cure. However, the efforts are being made to address this issue. The government has set up a drug resistance TB, that is DRTB treatment centers across the country to provide specialized care for the patients with the drug resistance TB. The use of new drugs such as bedaquiline has also shown a promising result in treating this form of the TB. But there is still a long way to go in terms of research development of the new drug and the treatment regimens for the drug resistance TB. Another challenge in the fight against the TB is reaching a remote and marginalized community. These populations often lack access to the proper health care facilities and are at a higher risk of the development of the TB. Efforts must be made to improve the healthcare infrastructure in these areas and provide a better access to the diagnostic test and the treatment. As we look a future about the TB in India, it is crucial that we continue to strengthen our efforts and address these challenges. The government must continue to invest in research and the development of the new drugs and treatment regimen, improve the healthcare infrastructure, and increase the awareness and education about the TB. But it is not just the responsibility of the government alone. We as an individual must also play our part in the fight against the TB. It is essential to educate ourselves and those around us about the disease and its symptoms. If you or someone you know is experiencing any symptoms of the TB, it is crucial to seek a medical help immediately. Early detection and the treatment can save the lives and prevent the spread of the disease. On this World TB Day, let us celebrate the progress made in India's fight against the TB and commit ourselves to achieving a TB-free nation by 2025 December. With continued efforts and collaboration, we can make this dream and reality and save the countless lives from deadly disease. The road to elimination may not be easy, but with the determination of perseverance, we can overcome all the challenges and make the India a healthier nation for all its citizens. It is all about the TB World TB Day. Namaste.